device is good, but the support is as good. Again, it's that whole almost a family package, so that works really well. Yeah. I'm Martin Quinton. I'm the critical care practitioner, and I do a lot of the procurement, and an ODP is my background in theatres, and then have a role up here. It's very helpful, really. It means that we don't have to worry about inappropriate use, I think, really, because we're getting education from them, updates to the bedside nurses, so they get educated in the use, and then we can step down or step up the care based on them visiting, really. Because we don't just use them on intensive care, they're in the other wards as well. It's nice for that continuity as well, so I think it's really useful. Yeah. We've got a really good rapport with all the advisors, and also the lads that deliver, and the professional, and we'll come and set the machines up if we want the beds up for us. And because they're Sheffield based as well, they are very prompt in getting the devices in for us, and also they will move heaven and earth if we want something specialist. Within probably 4 hours we can get something under a patient. Again, there were times when they would only phone during the day, but now they're getting more and more familiar with the fact that they can phone and ask for a device at any time of the day. And it's nice to have a friendly voice on the end of the phone, really, and also that they can bounce a call to a clinical advisor if necessary. So getting used to them by name now, which is nice. So it's sort of, again, it's that whole almost a family package. So that works really well.